welcome to our first learning collaborative with the Hispanic-serving Schools of Nursing and our mentoring support program. I'm Winifred Quinn, Dr. Winifred Quinn, Director of Advocacy and Stakeholder Engagement for the Center to Champion Nursing in America, the joint initiative of AARP, AARP Foundation, and the Robert Wood Johnson Foundation. Jasmine, who you'll hear from in just a minute, she and I are the two people on staff here who organize and implement our learning collaboratives and all of our work related to the mentoring support program, in addition to a committee that I will be reading their names in just a minute. What we would like for you to do right now is to use the chat to introduce yourself to everybody else. Please put in your name and what organization you're from, and what you hope to get out of hearing from your peers and us at CCNA on this learning collaborative. We're also going to send a survey out to the field in, Jasmine, when, a couple of weeks? Yep.
Yes, that's correct.
So we're going to send a survey to all of you and others, asking what is it that you would that you need and what you want that we could help provide for you to help you retain your students, help them graduate, and help improve, if need be, the NCLEX passage rates. So for those of you who are not aware of the Campaign for Action, it's at the Center to Champion Nursing in America, which is just about 15 years old. Again, a joint initiative of AARP Foundation, AARP, and the Robert Wood Johnson Foundation. Our mission is to ensure that all Americans have access to highly skilled nurses when and where we need one. And we run the Campaign for Action, which is about pushing out having a national campaign that helps organizations and individuals implement the Future of Nursing recommendations, first out of the Institute of Medicine Future of Nursing report, and now out of the National Academy Future of Nursing report that came out about 8 months ago. And mentoring, our diversity work started about a year after the campaign started. So we've been working on diversity for about 10 years. And how we mostly operationalize it now, Jasmine and me, with Burnell and others, is through this mentoring support program. And we started with historically Black colleges and universities in piloting a couple of convenings with them, in-person convenings when life allowed us to do so. And since then, we convene them mostly on a monthly basis, again, for a similar learning collaborative that we are having with you. A couple of times a year, we will bring all of the schools together with whom we work. It will be the HBCUs, Hispanic-serving Schools of Nursing, and American Indian Alaska Native serving Schools of Nursing. So, and then the committee. So we have a committee of nursing experts to help us plan and implement this learning collaborative. And the committee is comprised of Jasmine Burnell DeWitty, who you see, who's with the American Association of Colleges of Nursing and also a consultant to the Campaign for Action, Jose Alejandro from Mount St. Mary's University, who you see here, Lucia Alfano from the Westchester campus county section, Sandra Davis, who's representing the NLN, Leah Fitzgerald, also from Mount St. Mary's, Melanie Lowe from Chamberlain University, and also is a co-lead of the Campaign for Action's Arizona Action Coalition, Adriana Perez, who's out of the University of Pennsylvania, also a consultant to the campaign. And Jessica Wagner, who's with the NCAA. She convinced them several years ago to start a chief nursing role, and she got herself that job. We also have two leaders from the federal government on our planning committee, and they are Dr. Aisha Mix, who's the chief nurse with the U.S. Public Health Service system out of the U.S. Department of Health and Human Services, and Tara Spencer, who's with us today, who is with the Bureau of Public Health and Nursing out of the HRSA. And Margaret Avila, I missed Margaret Avila, who's with Casa Loma and Avila Consulting. So, so the purpose of this committee is we meet monthly, really, to plan the learning collaboratives and to engage you. And the learning collaborative, the organizations, the folks that we invited to this are all of you, schools of nursing, and about 65 schools of nursing that are Hispanic serving institutes, and your associated action coalitions with the campaign. So so at this point, what I would really like to do is to ask Jasmine to come on and talk more about, give us an update on the mentoring training workshop.
Sure. So thank you, everyone, for joining us today. My name is Jasmine Cooper, and I serve as the campaign's project advisor on our diversity work. So I am the lead advisor for the work with the HBCUs, Hispanic-serving institutions, as well as the American Indian, Alaska Native institutions as well. And since for the past 3 years, I think we've held a total of 4 mentoring training programs with the various schools, and our first being with HSIs in February of last year. And for those, I'm not sure who on the call today, if you were able to attend that training, it was a 2-day training, and where we were able to have pre-recorded presentations for preparation of the mentoring training program, and then a 2-day program that was live, where we really implemented some of the recommendations that we had to really help schools of nursing have either start a mentoring program or enhance their current program in order to be able to support their students of color in graduating and passing their NCLEX. With all of that, our main goal now is that we want to be able to convene the schools on an ongoing monthly basis, so that way we're able to offer you technical assistance, resources. With Tara being on the call, she's been able to work with some of the schools to learn more about funding opportunities. We really just provide whatever expertise that we think would be prudent to the schools at the time being. I know with the pandemic, we really did a lot. We focused a lot with the historically Black colleges on PPEs and virtual simulations. So we really just engage with all of you in the hopes that we can offer you additional resources that would benefit your schools. One of the main things that we did with the HSIs is we actually held an information session prior to the workshop to be able to really identify what would be some additional areas outside of just the mentoring program that we thought would be beneficial to tap into. So we had our lead facilitators really dive into some of those themes that we heard through that session. Some of them being, curriculum adjustments to better incorporate culture, diversity, and inclusion, cultural humility, cultural competency, even just holistic admissions. Some of those were like the key themes that we heard. And so that was also incorporated in the 2-day training. So if your school wasn't able to participate at that time, we actually will be providing you access to the pre-recorded materials as well as the additional resources. And so what I'm going to do now is actually put the link to our landing page in the chat, and I'm also going to just share my screen briefly so that way you can get an idea of what's on the website and what's available to you. So just bear with me for 1 second. And so here, as this pulls up for you, is the landing page of the February workshop that we held with the HSIs. This kind of just goes over our goals for the workshop that we had. And then as I scroll down, each module will give you a module objective. And if it was pre-recorded presentation, the presentation lives here. We like this idea in this format so that way faculty can actually use this as a training if they see fit for their faculty to help as they go through and maybe develop their mentoring programs and or enhance it. So you'll see here, it gives you who it was presented by and what the objective. We even have the PDF versions of the PowerPoint presentations that were available for this recorded session. And at the end of the page, and so it's going to scroll really quickly, we have the actual overall toolkit that we used that was with AACN and RWJF, and each activity that was associated with some of the presentations that you'll have access to. So we're hoping to kind of be a one-stop shop on all that could be mentoring for you and give you all the resources that you potentially would need to help your faculty, help your department if you see fit. And so we're really excited now to be at this stage to where we can engage with you and really hear more about how things are going at your schools of nursing and where we might be of service. And so I want to now have Wynn talk about the action coalitions and what that in collaboration is like with the schools of nursing. Wynn.
Thank you, Jasmine.
Yep.
So to have an effective national or nationwide campaign to help achieve health equity through nursing, we created coalitions or help build coalitions in every state and in DC. At this point, we have about 45 working action coalitions. Several states have inactive action coalitions. So, and those states, the action coalitions themselves identify what their priorities are out of the Future of Nursing reports and work to implement those. And what we do is we also encourage them to work on what we see as priorities, especially diversifying nursing. And again, our primary set of resources, or our primary work where we put most of our resources on diversifying nursing, is through the mentoring support programs. And so we encourage the action coalitions to work with you. And if any of you would like to be connected to your action coalitions, I don't see any of the action coalitions on here right now. If any of you would like to be connected to your action coalitions, please email me at wquinn@aarp.org. I'll also add that in the chat when I wrap up. And so to give you an idea, and I actually didn't even know that this amount of work and success was occurring in Pennsylvania, but Adriana Perez, who's one of our consultants, who's based in Pennsylvania, she helps the Action Coalition with their diversity work, and reported to us about how the Action Coalition works with the historically Black college or historically Black university in Philadelphia, Lincoln University. And so I am going to now, of course, I can't get her email, but that's okay. I can quickly find it. Since for the last 2 years, the Pennsylvania Action Coalition and its Nurse Diversity Council has partnered with Lincoln University on the Pennsylvania Action Coalition cohort of exchanged learning. So the objective is to bolster the HBCU nursing students' capacity to be successful in nursing school and in their tradition to professional nursing practice. The first cohort was only seniors, And along with their mentors, they provided very informative feedback to improve the infrastructure for the current cohort, including improving or increasing communications between the cohort and the program committee, and a desire for test-taking resources and tutoring for the NCLEX exam. The responses to the year-end survey showed that 89% of the students found the program to be helpful, and 75 of them reported that their mentor was a good match. Most students reported that using the cohort for exchanged learning toolkit and other resources was very helpful. And most impressively, 100% of the students maintained a GPA of 3.6 or higher in their last semester, and 100% are on track with their postgraduate goals. The current cohort is now includes juniors and seniors, and it's of 41 students, and they currently completed the orientation for the mentors and mentees to get to know each other. An exciting feature of that mentoring program now includes a focus on advancing health equity through policy efforts. So mentees and faculty are attending the National Black Nurses Day on Capitol Hill, led by the National Black Nurses Association. So they are in preparation for this leadership activity. The Pennsylvania Action Coalition Diversity Council will also host a training to introduce the mentees and the mentors to the Campaign for Action's Health Equity Toolkit and review the policy agenda in advance with the students. So, so they hope that this forum allows for rich dialogue and critical conversation going into the Capitol Hill Day, where students feel a connection to at least one of the priority areas and can learn more about how and why specific policy agenda is advancing health equity. So, so they're doing, what I love about that is they're doing the mentoring support work, and they're also advancing education, right? I think every nursing student, most nursing students have a policy class, and this helps them really like take some hands-on policy actions. So, and introduces them to new toolkits. So, so that's a very good example of what an action coalition can do to help a school of nursing advance your mentoring support program. I think I hand it back to you, Jasmine.
Yep, thank you. And Tara, I didn't know if you wanted to share some information about HRSA and some of the funding opportunities that are available, or what resources and assistance that you're able to provide. But we did want to pass the mic to you if you wanted to share.
I just wanted to say good afternoon. Definitely a pleasure to be here. We are looking at our FY22 investments right now in terms of nursing. We have a couple of opportunities that are on the street. Our nurse faculty loan program actually just closed last week, but currently open right now. We have our nurse education, practice, quality, and retention mobile health training program. So that's a mobile clinics program. So that one is actually open to, you know, any accredited school of nursing. It's still on the street. It'll be on the street until the 22nd. And so if any of you are interested in applying for that, you can reach out to myself or the project officer if you have any questions regarding that program. Some other investments that we have that just closed up are resiliency programs. We just have two that just closed. There's a technical assistance center to help with resiliency and burnout, you know, in the health professions related to COVID-19, as well as one that will support organizations and academic institutions to give them best practices in terms of resiliency and burnout of the workforce. And then we have two forecasted programs that are coming out of ARP funding. So the American Rescue Plan funding. So we have a community health worker and paraprofessional training program that will be on the street fairly soon. And we also have a public health scholarship program that's also forecasted again for FY22 to increase our efforts in the public health workforce space. So they're not nursing specific, but they are open for schools of nursing to be able to apply for. Our nursing workforce diversity program, we're in going into the second year of that cohort. So unfortunately, we don't have anything in that space right now, but we are looking at all of our investments across the board and looking at how we can implement, increasing diversity in the nursing workforce through all of our programs and not just specifically our diversity programs. So there will definitely be more to come on that. And then as we continue to look at our investments for FY23, we're looking in that space as well. So if there's anything that you need in terms of resources, we're working with our Office of Regional Operations to do some grant writing workshops. So as that becomes more available, I will pass that information on to Jasmine and Wynn, and she can share it with you all. But if there's anything that you need, just let me know. You can reach out to me. They have my email, it's in the chat, and I can set up conversations. We can chat via email, anything that you need in terms of resources or assistance, I'm here to help.
Thank you so much, Tara.
Okay.
Thank you. And so now that's just, we've said quite a bit since we've been on the call. And so we kind of just want to turn it over and get to know all of you that have joined us today a little bit better as to it pertains to your programs, as it pertains to maybe what you feel would be great opportunities and great resources that you might want to receive from us. And even just maybe even to hear about how your mentoring programs might be going, or what your plans would be to enhance a program that you have. We just want to be able to open the floor for you to share with us, so that way we can look for opportunities to engage with you even more and offer you additional resources. So if there's anyone that wants to get us started, please, just share anything with us as it pertains to your nursing programs that you would like for us to know.
And also something I'm also curious about is, and you could say it verbally, you could open your mic, or you could add it into the chat. Who of you participated with us when we convened about 30 schools of nursing last February? And how many of you is this new? Is this a new convening for you?
Thank you.
Oh, Ida, you're muted.
Hi, this is Kai Moore from the University of Arizona. I was not in the prior event, but we are a Hispanic-serving institution, and we do have a task force focused specifically on ED&I that includes students, staff, and faculty. But I think where we're missing is the mentoring piece and how we can more specifically establish a mentoring program for our students. This is done through one of the HRSA grants. That's for diversity with a PI that has worked very hard to do this. So, but college-wide, I think we could improve in terms of mentoring.
Great. So also, Ida, Arizona has a newly reformed and very motivated action coalition. It's co-led by the State Nursing Association, Donna.
Oh, yes, yeah.
Yes, and somebody who's on the planning committee for the HSI or HSI work, and that's Melanie Loeb from Chamberlain. So if you want me to put you in contact with the two of them, I'd be happy to do that.
Okay, that would be great. Thank you.
All right.
I didn't know that Melanie Loeb was at Chamberlain, though.
She is. I think she started in a new role sometime last year, maybe in 2020.
Okay.
She's very familiar to Sue Hassmiller, and Sue Hassmiller made sure that I got her active.
Great. Thank you.
You're welcome.
That's great. Thank you for sharing. And yes, Christina, yes, I see you have your hands raised. Thank you.
I just put in the chat box, I was on a ventilator last year this time, but I'm all better and I'm back to work miraculously. I had a massive pulmonary embolism and I had great nursing care from a Hispanic nurse.
Wow.
Okay. The woman who took care of me in the ICU actually was one of our adjuncts, who herself is DACA.
Oh, wow.
Okay. And what is important about this is that she talked to me about the absolute necessity for us to be able to continue our program which is chronically undersourced. And this is a problem everywhere in schools that are traditional HSIs, HBCUs, and Indian-serving institutions. These are probably some of the most chronically under-resourced programs. So I am so grateful for this opportunity to be here with you. I just learned about this program because I have just recently returned to my position. So the one thing I would like to know is, I read in the chat box that last year the workshop was a 2-day workshop, and is it possible to obtain the recordings from those? Okay, that's my first question.
So to answer that first question, we left the 2-day workshop as a more intimate setting. So the only thing that we're providing are the pre-recorded materials that's on the landing page that we shared.
Which are plentiful.
Yes.
Wonderful.
Yes.
Okay, then since it was, this is my next question, since it was an intimate type of workshop, I will tell you, I truly believe that we do our best work in our relationships with each other. And so I'm sure that I'm not the only person who is going to be new to this effort. Is there some way that I and others who are just joining this effort could have something where we could either be intimately connected with programs that are farther along in this process, or with each other, so that we can really connect and get and give the type of support that's really required in doing this really important transformative kind of work?
So thank you, Christina. So I encourage you to also put that in the survey that you're going to get. And first of all, this learning collaborative, as we meet monthly, it will create that community. It will help create a community, especially the more you return, the more the community will build. That's what we see with the HBCUs that we've been convening for a couple of years now. And if we get funding for another program where Jasmine and I and others have the capacity to pull together another group or sets of schools for a more in-depth training, yes. But right now, that is not in our budget. But the resources are there. Another resource is Vernell. I hope this is okay. Vernell can, so neither Jasmine nor I are nurses. So Vernell, and that's one of the reasons why we have hired Vernell as a consultant. Vernell can meet with folks individually if she has time, or maybe a set of you, to review the products that we created and the videos. They are really great videos, and the products that exist that can help you. Is that okay, Vernell?
Absolutely. All we need to do is find times that are mutually agreeable for both of us. We'd be happy to do that. Yes.
Great. And while I have the mic open, hey, Chi or Ida from Arizona, can you put your email in the chat, please, so I can connect you to the Action Coalition folks on email?
Sure, absolutely.
Okay. And thank you, Christina, for that request. I hear you.
Yes, and I will say, to add on to some of Wynn's points, the Learning Collaborative is really where we are able to highlight our strengths and even sometimes the weaknesses within the programs. This is kind of our peer-to-peer engagement opportunity. Another reason why we didn't record it is because we did a lot of action planning, a lot of breakout rooms, things like that would have been really disruptive for the recording. And we wanted our faculty and deans to be free to express whatever they wanted to express and not think that we would share that recording later, which is why we started with the pre-recorded sessions, because that really goes over all the materials, all of the things that tie into the toolkit. But I think that this is a key opportunity, like what we did with sharing some of the successes of Pennsylvania Action Coalition and that Lincoln University. We'll be able to do the same with all of you on some of the schools that are doing very well. They'll be able to share what they're doing well, what are some key resources and things, and and give you some recommendations. So we'll be sure to have some sessions throughout the year that we think would apply to your question. Okay, and thank you again. Is there anyone else that wanted to share either, things that they might be interested in learning more of, how their program has gone since the training? I know we have quite a few new people on the call, but there are some others, and some of our facilitators are on, so I don't want to pinpoint specifically, but if you want to share anything with this group, we would love to just hear from you, because some of you on the call are actually faculty, even though you may have been a presenter during the workshop. Any takers?
I think you just got to call us out.
Okay, well, well, I will say, I was, Juana, did you want to share anything? I know Juana was a facilitator, and she also is a faculty at one of the HSIs, and so happy to see your face again since February, but just thought, maybe you might want to share anything with us, or even your experience with the program in general.
Right. Thank you so much for that. I think one of the biggest takeaways for us all right now as we're dealing with the pandemic and nursing education is that all programs across the nation are being impacted by the pandemic and are seeing a drop in enrollment. I know specifically, I'll speak for myself in my DNP program. I have multiple groups in there, but I do not have a single Hispanic student in the DNP program for our first cohort. We just finished recruiting for spring 2022. And I have no Hispanic students in that cohort as well. So I agree that recruiting is critical across the board. And one of the biggest barriers that we're finding is funding for our DNP students. We've begun the process of our nurse faculty repayment loan at the university, and we should have that running shortly. We're working on our internal operations to have that available. We did open a scholarship type of fund so that if anybody wants to drop in money into that bucket, then it would be used for DNP student needs. We did have COVID relief where students got $1,000 if they came down with COVID, and then there was another relief fund on top of that. And then there's talk about other reliefs in that area as well. But it's clearly impacting registration across the board in advancing education, in addition to the barriers that we already had and challenges.
And Juana, were you on when you heard when Tara presented about funding out of HRSA?
I'm sorry, can you repeat the question?
Were you on when Tara Spencer presented on the funding coming out of HRSA?
I may have missed that particular meeting.
Okay, there's a lot of funding available in HRSA right now.
Mm-hmm.
And actually, Tara didn't say this, but I know it. HRSA needs schools of nursing to apply. There are schools of nursing that don't apply for the funding,
Okay.
including schools that serve predominantly people of color and the underrepresented, underserved, people from underserved communities.
Mm-hmm.
So, and she did announce that if I have the title of the name of the office, the regional operations offices out of HRSA are going to offer grant writing programs for HRSA grants. And if people are not signed up, for the Campaign for Actions campaign update, I highly recommend that you do so. We send out an e-newsletter every other Tuesday. And in it, we provide a lot of information about various funding sources, including HRSA's. When HRSA's programs are announced, we include it. I mean, you could also sign up for HRSA's announcements, but we also provide other funding announcements that we are aware of. Okay.
And one opportunity that we did take up, there was an opportunity for DNP students to join in a DEI type of event, a virtual event. And we're happy to report that we were able to get a 95% discount for tuition. So each DNP student attended for $2.50.
Wow.
So I can't beat that price. Those are our
Right.
bargaining powers.
Yeah.
I learned them from Jose.
Wow, that's awesome. Thank you. And when we actually did get a question in the chat And the question is, are there any opportunities for any research activities?
Well, I mean, there's probably, I'm sure there's not so much for the campaign for action. We're the campaign for action. So my little sort of joke is we're the campaign for action, not research. And so, but there are plenty of people who work with us who do research, right? So 4 of our 5 diversity consultants are researchers at their universities, and their research does help inform their expertise that they bring to all of you that need help. And so, but as far as more hands-on research, I would again encourage you to look at the funding coming out of HRSA and obviously NINR. So I hope that helps.
Does anyone else like to share with us before we move on to our next topic? Oh, I see 2 people. Hello, Leah. Yes.
Yeah, hi, Leah Fitzgerald from Mount St. Mary's University. I have something to share that's just recently come up. So we were contacted by UCLA. So Mount St. Mary's does not have a doctoral program, but they've reached out to us and we're working on a grant with them. The grant is University of California Hispanic Institution Doctoral Diversity Initiative. And the goal of that is to develop and implement a 5-year regional PhD pathway for students. And so not only for students, but also for some of our faculty. So we're really excited and hoping that that gets funded and off the ground this summer. So
that's fantastic. You know, another way that what you could do together, especially for the schools of nursing that are in within states. And this is something that the Maryland HBCUs achieved 2 years ago, is they got a statewide mentoring training fund from HRSA. So you could look for that too. You could, well, and maybe what we could even do is put you in touch with the PI, Maya
Anderson.
Yep, Maya Anderson.
Yeah.
Yeah, Maya Anderson organized this, and it wasn't, and she opened it up to, I think she ended up opening it up to all the schools of nursing. So with Maryland, it's not as big as California, but it might have more schools than Arizona, or it might have maybe around the same amount of Arizona. I don't know. And she was able to secure a nice, grant to help all the schools with their mentoring support program.
Great. And yes, Annie. And oh, there you go.
Hi. My name is Ann Lum. I'm from Cal State San Bernardino, and my colleague Evangeline Gagalang is here too. But I'm humbled to be with this group. I am all about networking and sharing information. The word that really popped in my head when I first saw this campaign was mentoring. I'm a big advocate of that, and we are a Hispanic-serving institution. We have about 62% of our students are Hispanic, but we have a very big diversity in all different ethnicities and cultures. So I am also an advisor for the Coyote Student Nurses, and I really want to impact our mentoring program to make it stronger and reflective of success and things like that. So I'm really happy to be here.
Thank you so much. We're happy to have you. And we are just happy to be a resource wherever we can be. And so we just wanted to start off with our first learning collaborative with kind of just introducing ourselves again, and for the first time to some of you who are new to us, and then go from there as to look for opportunities to engage you as the months go on. So if there are ever a time where you have an idea and you would love to learn more, please email us about something that you think might be pertinent and beneficial to all of the HSIs, and we'll be able to kind of tap in and see what we can do from our end to either feature someone or find a resource or anything like that. That's basically what this learning collaborative would be for. And so, you know, we are going to be your point of contacts going forward, should you ever need anything, and you think it would be good for all. And so with that, we really want to just, if no one else wants to share, we'll really just kind of just start the process of going over, oh yes, thank you, Dr. DeWitty. So we are, like Wynn mentioned in the beginning, we are going to send out a survey. And so the survey is really going to help us identify some key areas of opportunities that we can engage all of you, some key topics, or even as it pertains to your mentoring programs, what would be some key things that we could either maybe do a small session or a series on, where we can tap into specific topics that you would love to learn more about. So if you review our website and you still think that there's opportunities or assistance that you need about your mentoring program, and you'll also have access to the toolkit. If you want to learn more, we can definitely offer some programming going forward. So the survey will be coming out in the next few weeks, and we would love for as many people as they could to fill it out. So that way that will best help put us in the direction that we need to be to support you. Excuse me. But yeah, with that being said, I did want to just say that we have quite a few things coming up that we're going to be offering overall. In addition to the monthly learning collaboratives, we'll probably do a quarterly call with all the schools of nursing that we work with, like Wynn mentioned before. One of the big opportunities that we have coming up is a webinar with NCSBN on testing. And so we're working with them now to develop that webinar, and that will be our first quarterly webinar that we'll host with them. But there's also quite a few things that are coming up that I'll hand it over to Wynn to kind of close this out and share with you. But I just wanted to thank all of you for joining, and I hope to see you in the coming months. And please look out for communications from me as we get funding announcements or anything else that are pertinent, conferences, anything like that. We love to share them with you, just in case you want to tap into them. So thank you again.
Great. Thank you, Jasmine. And I also want to reflect a word that Anne used, and that is, I am humbled to be with you. Really, truly, on behalf of AARP's 38 million members, thank you. Truly, thank you for everything that you do and for preparing the next generation of nurses. So speaking of next gen, Jasmine mentioned that we will be scheduling a webinar with NCSBN so that they can help provide schools of nursing information to help you prepare your students for the next gen NCLEX exams. We've been getting that request for a couple of years from the HBCUs, and NCSBN has agreed to do so because their current process of informing schools of nursing and a state-by-state process is really an inequity issue. And so they have committed to doing this with us. They're going to take a look at, and then they're going to archive the webinar on their website, and they will audit it yearly, annually, and if it needs updating, they will have a new webinar to inform the public about how to prepare for the next gen NCLEX. So, so we're very excited to work with them on that, and to bring, to invite you, the HBCUs and the American Indian Alaska Native Serving Schools of Nursing, as well as our general audience. We're opening it up to all, but we're really target marketing this program for the 3 sets of schools that we work with. And then, you know, it's all about funding. You've already mentioned several times that you need funding. And for funding, it's really good to have a good case statement. And so on Monday, we are, Sue Hass-Miller is going to host 2 sets of people who talk about how you use health equity to do fundraising, which you could do for mentoring. And so it'll be the Blue Cross Blue Shield Foundation of Michigan, who will talk about why funders, why philanthropists are very interested in funding health equity now. And then a nurse who's now going to be a senior fellow with us at the campaign. His name is Paul Leon. He's from Los Angeles. He's going to talk about how when he meets with prospective funders, and he's a very effective fundraiser, he brings with him or shows them, if it's online, he shows them a copy of the Future of Nursing report and talks about health equity. So he'll talk to you about how you can use the Future of Nursing report in building your case statement and in making your pitch. And then on the auspicious date of February 22nd, 2022 at 2 p.m. Eastern, we are going to have a webinar. It's a trainer and a train the trainer webinar for the Campaign for Action's Health Equity Toolkit. It's how nurses and others really can help you work at the community level to achieve health equity. And they use a lot of nursing concepts. Jasmine is a co-author of it, and another former staff person from CCNA. The rest of the co-authors are our diversity and inclusion consultants, and two of them, Piri Ackerman-Barger from UC Davis, who's also a senior fellow with us, also at the campaign, and Dr. Lisa Martin, who's at the University of Minnesota. They will lead that webinar. So again, that's on the auspicious date of 2/22/22 at 2 p.m. Eastern.
Yes, thank you, Wynn. So I will, for those who are new, if you didn't get the invitation for Monday's webinar, I can go ahead and share that invitation out. And we have not actually released the registration yet for February. That's probably either going to happen tomorrow or this week. So either tomorrow or Friday. And so we'll make sure that all of you get that invitation for that training next month.
And next, did you send it for next week too, Jasmine?
Yeah, I'll send both.
Okay, great.
So I'll send the one for on Monday today, and then as soon as we release the invitation, I'll send that as well for February.
Right, and I think before we release the invitation, it's actually in my box to like do something with it. I have to approve it or something. Yeah.
Possibly,
Okay.
yeah. Okay. So yes, so that really is it for today. We just wanted to thank you all for joining us and for sharing about your programs, and we hope that you'll continue to engage with us on a monthly basis as we come up with various topics and things. And please be on the lookout for the 2 invitations as well as the survey, so we can learn a little bit more about you to help provide you with any technical assistance that we can. So thank you so much.
Thank you, everyone, so very much. Thank you, Jasmine.
Thank you.
Thank you, committee members, Vernell and Jose and Leah.
Thank you. Have a
Tara.
good afternoon.
Yes, have a great day.
Bye-bye.
See ya. Thank you.